I have the pleasure of introducing our next speaker. It's Michelle Gaspar, and she is a veterinarian. She is going to be speaking on a topic called Healing the Wounded Healer. I'm hoping you all saw in your confirmation email the citing for the question written by Chris Adrian. If not, we will have that link on the website for you. Dr. Gaspar is a veterinarian at the Urban Veterinary Team in Chicago, and she's a national speaker. She graduated from the University of Wisconsin-Madison School of Veterinary Medicine. She practices integrative medicine, which combines the best treatment in medicine that traditional Western medicine has to offer with alternative therapies such as acupuncture, herbal remedies, and chiropractic therapies to help promote healing and wellness for her patients. She is also a member of the American Board of Veterinary Practitioners as a certified feline specialist and is one of 80 feline specialists in the entire world. When Dr. Gaspar is not caring for animals, and primarily cats and dogs at Urban Vet, she lectures at veterinary conferences and is a consultant for the Veterinary Information Network. And she's going to talk about healing us. Thank you.
Well, can everyone hear me pretty well? Great. It's really a pleasure to speak to everyone here this afternoon, particularly the first year class at MSU. And I'm going to dedicate this afternoon's lecture to each and every one of you. I consider all of you to be colleagues right now, not future veterinarians. Welcome to the profession. What I'm going to talk about this afternoon is going to dovetail so nicely into Dr. Duncan's earlier lecture and what we just heard from Dr. Reynolds. And I'm going to turn the concept of wellness, of welfare, a little on its head, because what I'm going to talk about this afternoon is I'm going to talk about welfare to each one of us. Everyone in this room, no matter if you are a clinician, working in a shelter, perhaps you're a veterinary technician, other support staff, or my young colleagues here, you are called to a very, very special type of work. And in addition to being a veterinarian, I'm also a psychotherapist. I have a master's in counseling, and I do have a small psychotherapy practice in Chicago. I also work with the Veterinary Information Network and the Foundation in presenting psychosocial resources to veterinarians. Probably for the last 4 or 5 years, I've really switched gears. So my primary work on VIN is developing clinical rounds, courses, and online programs for veterinarians, students, and staff in a way to make us healthier. What I'm going to distill for you this afternoon is a lot of what was just presented on VIN for a pioneering course that was called Healthy Clinicians. It was a course that took me 2 years to get approved. RACE, which certifies continuing education, doesn't look too kindly on courses like this. But I knew that there was a way to present healing and psychosocial, psychological resources that we all need and that I would bet that 99% of us in this room never received. I know I didn't either. And when we took surveys from the 180 veterinarians who just finished the Healthy Clinicians course, almost to a survey, they said, had I only had this in veterinary school, I would have been healthier, I would have been happier, and I would have seen the work that I'm doing as a privilege. And I'm going to skip to the end of my lecture first and hope that by the end of my 45 minutes with you this afternoon, you are going to get a renewed sense of how you can be human and humane in what you do, and how you can go out of here with the sense that what we do, our vocational call, if you will, is a tremendous privilege. And so we'll start. We have some objectives for this afternoon's talk. I'd like to review the concept of the wounded healer. It's kind of a buzzword, so I'd like to give you a little bit of background on that. I'd like to discuss our potential areas of woundedness. All of us here are sitting with psychological wounds. I would say that our psychological wounds got us to the work that we're doing. They can make it a very rewarding work. We can actually heal through our work if we pay attention to our wounds. But I will tell you that our wounds can be devastating if we don't pay attention to them. We're going to consider how our woundedness prevents us from seeing our life's work as an enjoyable endeavor. I still get up every single morning, grateful to be a veterinarian and anxious to be able to get into a clinical setting when I have that opportunity. And I want all of you here to be able to tap into that same understanding. And we're going to discuss ways to promote psychological health in spite of our woundedness. So kind of a tall order. So who's the wounded healer? This was actually a term advanced by Carl Jung, who was the father of analytical psychology. Jung was actually a student of Sigmund Freud. He believed that Freud was a little wrong on his drives, and as was the case with most of Freud's students, there was a very difficult parting of the ways. So Jung thought that it was actually critical that every therapist and psychotherapist understand our woundedness. So he thought, unlike Freud, that the psychotherapist was not some incredibly wonderful human being who did not ever know the human condition, but could tell you how to save your life and how to turn it around. What Jung said was, we're all wounded. And when we can know our wounds, we can go through our wounds, we can actually not only help our clients in a psychotherapeutic setting, but ourselves as well. And so the woundedness comes from many, many areas. It comes from family of origin issues. Maybe you come from a broken home. Maybe you lived in foster care. Maybe you had a loss of a parent, a sibling, a grandparent. Maybe the first loss that you experienced as a child was a beloved pet, and how was that loss handled? These are only some examples of the wounds that can drive us to our chosen profession. And we carry those wounds forward every single day. We just have to be gentle with them and acknowledge them. The wounded healer actually comes from a Greek myth. Chiron was a centaur, and he was the son of a Titan. And the Titans were immortal. So Chiron was not supposed to die. There are two myths connected with Chiron. One was that he was involved with Hercules drinking a sacred wine. And the aroma from the wine wafted out of the cave where they were drinking, and the aroma was so delicious that it angered the other centaurs. Chiron was kind of a special centaur. He was considered to be a very gifted medical healer. Hercules shot some arrows. One of the arrows fell on Chiron's hoof, and he saved, actually, Hercules' life by pulling the arrow out, but died from the wound. So Chiron the centaur is actually the prototypical wounded healer. So what's so important about these wounds? The wounded healer only is able to help himself or herself when you acknowledge the wounds, and when, instead of being bitter because we carry these wounds with us, we recognize it as that which connects us with another. And particularly for those who are interested in clinical practice, who are going for clinical practice as veterinarians, or who work with the public in a shelter situation, I can tell you that the bitterness and the victimization is certainly what I see as one of the great wounds of our profession. And so we have a choice. We can either decide that we're going to have a hierarchy where we're here and they're here, our clients, our colleagues, or we can understand that we are all connected by our woundedness and become colleagues to one another. So what do our wounds look like? These are the top 6. Control issues, perfectionism, unrelenting standards, approval seeking, recognition seeking, self-sacrifice, defectiveness, shame, and emotional inhibition. These are called maladaptive schemas. These are incorrect ways of thinking, but we're all walking around with them. And so, how do these schemas get put in our heads? They're usually put there by pretty well-meaning caregivers. So somewhere along the line, usually before we were 5 years old, a parent, a grandparent, a teacher, a neighbor, a close friend, interacted with us in a way that caused our thinking to turn a little bit. They can result from emotional abuse. And because we hear these schemas early in life, they're often long-standing. And they're potent triggers for wounding. I'd like to go through them just very briefly. So control issues. A lot of veterinarians like to be in control. We like being the person in the clinic that knows the most. We think we have a handle on what's best for every single patient. Where control issues get us into trouble clinically is that they do not permit us to understand the backstory, or we lie to ourselves and we think we understand what the story is behind a particular patient or client. I guarantee you we're never going to learn the backstory. I'm going to spend some time on perfectionism and unrelenting standards because I guarantee that everyone here today has this in some degree. Maybe we're approval seeking or recognition seeking, which means that we do our work so that we're liked, so that we think that people will think well of us. And where this gets us into trouble is when we get into a client situation and the client says, you don't know what the hell you're talking about. And they come at us with a less than positive conversation. Self-sacrifice. I've worked in 3 shelters. I've worked in a number of veterinary clinics. I've talked to veterinarians as part of my work with VIN. And I would say self-sacrifice is huge. What self-sacrifice prohibits us from doing is establishing boundaries. And I'm going to tell you right now, boundaries are good words. They're not bad words. We all need boundaries in order to do our work well, to protect ourselves, to have, if you wish, a detached attachment. When you say the word detachment to most people, they actually recoil in horror because detachment is kind of a dirty word. As a matter of fact, I think a lot of us in veterinary medicine like to think that we care more. We certainly care more than physicians, right? Physicians don't care about their patients, but we care a lot. Self-sacrifice gets us into huge problems. Defectiveness and shame. I think it's very important to realize that we can choose how we interact with people because we're afraid of being shamed. And then emotional inhibition. Sometimes we just shut down. I would say that our most common wound in veterinary medicine is the maladaptive schema of perfectionism. And this is a huge problem because perfectionism is actually a good thing. I guarantee you that everybody in the class of 2018 would not be sitting in that seat that you're sitting in right now unless you were a perfectionist, right? What did they do? They chose you for really good GRE scores. They chose you for really high GPAs. They chose you for all those things that you worked really, really hard to. So it's kind of the maladaptive schema that keeps on giving, right? It's really, really hard to get rid of perfectionism. Perfectionism, though, arises from one of 2 states, and I'll leave it to you to decide where your perfectionism came from. I know where mine did. We either feel defective, so we have to work really, really hard in order to feel competent, or we've been complimented by somebody, and so that really felt good, so we want to be striving for that perfectionism. So where the last one would look like you played that so well if you played the piano. You really played so well. You're such a good girl. You're such a good boy. And that feels kind of good. So that's the second way perfectionism is. And unfortunately, I think a lot of us here have heard about our defectiveness. Maybe we didn't get a mother or father to tell us we were a good kid unless we brought home a sterling report card. And some of us still brought home a sterling report card and still didn't get that atta-girl or atta-boy. So with perfectionism, failure isn't even a normal failure. And I know the class of 2018 will take this near and dear to your hearts, right? 95 is a failure to a perfectionist. It's not a 60, it's a 95. And the problem with perfectionism is that it's impossible to achieve perfectionism in this life, yet we still go for it. On my drive-in from Chicago yesterday afternoon, I was talking to a young colleague who's been out of school for 2 years, and I've been doing some one-on-one therapy with her. And she is absolutely paralyzed in her practice because she cannot make a mistake. She believes that when she makes a mistake, she pretty much has to leave her job. Unfortunately, that's the pattern that she's used for the last 4 jobs that she's had in the last 2 years. So what we're trying to do is break the pattern. She gave an intranasal Bordetella vaccine to a dog as an injectable 3 weeks ago. She was absolutely unable to go to work the next day. She thought the dog was going to die of liver failure. She thought she was going to be cited by the board. She thought she was going to be fired, all these kinds of things, none of which turned out to be correct. As a matter of fact, the dog is doing well and no problems, and the client understood the mistake. But this is perfectionism in the extreme. Perfectionism and self-sacrificing is usually the dynamic duo, because what we're doing is we're trying to do the impossible, never make a mistake. Has anyone here never made a mistake? And the self-sacrificing, as I said, makes it really difficult for us to establish good boundaries. So I'd like to spend just a few moments on boundaries. Boundaries, you're going to need to develop boundaries. You cannot be all things to all people 24/7. And I think a lot of us in veterinary medicine make the mistake, you know, we're on a triad, right? There's the doctor, there's the patient, and there's the client. Now, on the spectrum of client and patient, how many of you tend to be more patient-oriented? Show of hands. Patient-oriented. So if you have to make a decision, it's fine. So if you have to make a decision, let's see the hands again. Patient. Client. Okay. I would argue, and so it's a little bit, it's patient skewed, and I think this is where certainly small animal veterinary medicine has gone. So let's think about it this way. Who are we really working for? Yes, we're the advocate for the animal, but we're actually working for the client, right? And Dr. Reynolds' last statement about human communication is so important to establishing good boundaries. What I'm trying to do is I'm trying to get us to the point where we can see that there is a need for a more humanistic veterinary medicine. Ultimately, you have to bond with the client in order to help the patient, and there are going to be some patients you cannot help because the client doesn't want to go there, can't go there, whatever the story. If you're self-sacrificing, where this is going to go, is you will be so patient-oriented that at times what you do is you do a lot of pro bono work. Everybody in this room has done pro bono work if you're a clinician. Pro bono is good. But would you not charge for a service? Would you be on cell phone 24/7? Would you work holidays on the phone? Would you be always there? You have to start developing good boundaries. But if you're self-sacrificing, if it's only what's good for them and not for you, you start to get resentful. And that's the endless cycle where you work hard, where you feel put upon, where you judge others, and this can result in either burnout or compassion fatigue. So is there a difference between burnout and compassion fatigue? Well, oftentimes the terms are used synonymously, but they're very, very different. A burnout typically is the mental state where there's no validation, you're working really hard, you're not getting anything for it. And it's actually associated with decreased cortisol levels. Compassion fatigue historically was used to describe a post-traumatic stress that nurses caring for war wounded had. So they were in the trenches. They were changing bandages. They were giving morphine injections. They were sitting with the soldiers. It's historically been referred to as the cost of caring, and it's associated with increased cortisol levels. Now, I'll kind of tell you that I have a personal bias. I think compassion fatigue is talked a lot about in veterinary medicine, and I'd probably argue from my personal experience with veterinarians, I think we're burning out rather than fatiguing from caring too much. And there's probably a visceral reaction, at least for some of you sitting there, going, well, how can you even say that? I mean, we care so much. We're caring for patients. I'm going to tell you that your support staff probably has compassion fatigue. Folks working in the shelters probably have compassion fatigue. And I will tell you, your clients often will have compassion fatigue. When you get into the world of small animal veterinary medicine, if you're going there, you're going to see people coming to you with shoe boxes full of medication. They're giving cats with chronic renal disease 4 medications, a special diet. They are given fluids once or twice a day. And I'm always intrigued how these people can tolerate this level of care. So, is there a way that we can care, we can do our jobs, and we can not burn out? So, let's take a look at what we might feel if we have actually burnout, and some of us actually may have compassion fatigue depending on our type of work. There'll be lack of enthusiasm. There'll be criticism of others, colleagues, clients, and staff. This is usually what happens with perfectionism because we expect ourselves to be perfect, and so we expect everyone else to be perfect. We lack compassion. We can't stand the crying client. We can't stand the staff member who just left her husband the night before and is coming to work with what we think is a chip on her shoulder. And we have tunnel vision so that we believe that our truth is a truth with a capital T. And what I'd like to tell you is that everyone here, within reason, within societal cultural standards, has their own truth, and it's not a universal truth. There are very, very few universals. Where we get caught up in our own heads is by thinking that everything that we think personally applies to everyone else. And the cost of this burnout, plus or minus the compassion fatigue, is that a lot of us leave the profession. Many veterinarians are looking to do something else. On VIN, we have a poll going. If you had to do it again, would you? And a high percentage of veterinarians in clinical practice say they would not do it again, nor would they tell their children to go into the profession. So what happened? You know, when you think about it, veterinary medicine has some of the most healthful ways of living a life. What a privilege it is. We get to heal. We get to mitigate suffering. We get to play with really nice animals on a daily basis. And I do consider my clinical time playing. I do. And we get to interact with people. And the problem is, I think a lot of students go into veterinary medicine, and some clinicians too, thinking they're not going to have anything to do with people. Well, until the day comes when dogs and cats drive themselves to our practices, with the hedgehog or the guinea pig in the back and have their own credit cards, we will all be dealing with people. And this is a huge problem when people get out and practice. And I'll tell you, even as a fourth-year student where there will be more client interaction, or third year if you're going into clinics a little early, you're protected in school because there's still an intern, a resident, and an attending on top of you. But when you're standing across the exam table, things get a little different. So, is this where we're all headed? Do we come in bright-eyed, class of 2018, and then by 2022, 2024, we're wondering how we got here and how we get out? I would say that burnout is not the trajectory that we need to go. And there is a way, and I think earlier this morning someone said, you know, how do we keep our humanity in this process? Well, I'll tell you that there is a way. Not the way, but there's a way that I'm going to talk to you about a little later in the talk. So how do we protect ourselves? How do we become focused? How can we be compassionate to others? So neuroscience has shown, and this is by way of introduction, that what I'm going to talk to you about today, so this is hard medical science for those of you who don't want voodoo. This is a way where our brains are going to be healthier. We're going to decrease cortisol levels. We're going to decrease our blood pressure. We're going to increase serotonin and beneficial neurotransmitters. We're going to lay down new neural pathways. And we're actually going to be happier people. And it's mindfulness meditation. How many of you here have heard about it? Any practitioners? Excellent. Actually, Dr. Abood, we're all like this, right? Okay. So before everybody runs out screaming, I am not here to turn anyone into a Buddhist. So what is mindfulness meditation? It's a secular contemplative practice that seeks to train the mind so that we can observe what the environment is showing us without making judgments. You know that little monkey that runs in your head with 100 thoughts an hour? And the default position is going to be that we observe ourselves without judgment. We look at each other with compassion. And we don't live in the past, which is where depression comes from, nor do we look in the future with anxiety. It's based upon Vipassana meditation, and this was probably the first meditation that was taught by Siddhartha Gautama, who was the Buddha. As I said, no one here is going to be a Buddhist this afternoon, fear not. The Buddha actually did not consider himself a deity, nor did he start out trying to start a new religion. What the story was is that he was actually an Indian prince. And his mother died in childbirth, and so his father decided that the kid was not going to want for anything. So he had 2 palaces, courtesans, the best food. There was always someone with an umbrella so he wouldn't get the sun on him. And he started getting kind of bored. So one day he took his faithful servant and he said, let's go for a walk around the village, shall we? And they met a corpse, they met an old man, they met a sick person, and they met a dying person. And he freaked out. And he said, wow, I don't think I can really tolerate this. So he went back to the palace, decided he was going to figure out how to beat all of this, how to beat old age, death, and sickness. And the style of the time was that you developed a very ascetic practice. So you starved yourself until you were a wreck of bones. You didn't wear any clothes. You slept in graveyards. You did all kinds of things. And about 5 years of this, and he was hungry. He didn't look really good. And he still wasn't any closer to it. So he decided there was another way. And the story goes that he sat under a tree. He gave himself one night to be enlightened, and became enlightened sitting under the banyan tree overnight. So the bottom line is that we all have internal resources that we have lost. because we too can be happy, healthy, and enlightened, and have a good time doing it. So who practices mindfulness meditation? Well, John Kabat-Zinn in the 1970s brought mindfulness meditation to the University of Massachusetts. And since that program's inception, and you can go to the University of Massachusetts, you can take a 6-week course on stress reduction. It's been taught around the world. The University of Wisconsin-Madison Center for Investigating Healthy Minds, Dr. John Davidson, basically is doing most of the neuroscience behind this, but there are active groups everywhere. Agnostics, atheists, Jews, Catholics, Christians, you name it, everybody practices it. Young people, old people. The only contraindications for mindfulness meditation are active schizophrenia and severe unrelenting depression. So if no one here has either of those two, we're good to go. It's been used with patients with cancer, immune-mediated disorders, depression, anxiety, chronic fatigue syndrome, low back pain, and almost every other syndrome and disease that you can imagine. And most of these disorders have statistically benefited by mindfulness meditation. So how does it work? Well, it upregulates the centers of the brain that are involved with empathy and compassion, so the neocortex. It downregulates those areas of the brain that are associated with anger and aggressiveness, the amygdala. And it particularly prevents the amygdala from hijacking us. So the amygdala is that portion of the brain where if we've seen a snake at the side of the road and the snake comes towards us, the amygdala kind of makes sure that we remember that so that the next time we see a snake or something else that is fearsome to us, we avoid it. But the problem is that the amygdala is kind of stupid. So in addition to seeing something that is a snake, the amygdala would tell us, for example, that a coiled rope would also be something to avoid. And over time, we develop this sense of what's fearful to us, what we don't want to do, where we don't want to go, thanks to being hijacked by the amygdala. Mindfulness downregulates cortisol, upregulates serotonin, and it balances blood pressure and blood sugar. So can mindfulness help those of us who work with animal welfare? Well, here's most interesting work. Dr. Mick Krasner is a human internist at the University of Rochester, and he's done the lion's share of looking at mindfulness meditation benefiting physicians. So for the last 7 years, Dr. Krasner has offered a mindfulness meditation course. He's had over 800 physicians take his course, and he's surveyed them repeatedly over the years. And so the most important thing is not only do people who do mindfulness have less burnout, less compassion fatigue, they enjoy their work, they make fewer errors because they're focused, but the biggest thing is their patients do better. Statistically, their patients do better. And why is this? Because their patients are benefiting from focused awareness. Everybody in this room has had that very delicious feeling of feeling that you are the most important person to one person in a conversation. You've all felt that, right? That heart-to-heart connection where something is right. It's a delicious feeling. Once you've had it, be it from a parent, from a brother, a sister, a teacher, whomever. It's a wonderful feeling. So no wonder that your patients and your clients would benefit from that too. So we call it the paying forward of mindfulness meditation. Anyone who practices it is going to be less stressed, more relaxed, able to go through life with a different sense of purpose, but others benefit from it too. So for the last 4 years, I have offered mindfulness meditation on the Veterinary Information Network, and we have actually over 1,000 veterinarians and veterinary support personnel who have taken the course. It's an 8-week course, it's online, and we have surveyed our colleagues too, and statistically, it is significant in that they report less stress, better staff and client relations, better familial relations, and more engagement with clinical practice. Sounds pretty good. So what I thought we're going to do today is we're going to do a little mindfulness. Everybody up for it? And for those who are eye-rolling, just think of the great topic you're going to have at dinner tonight when you talk about the goofy thing that you had to do. So we're going to sit for 5 minutes. And that doesn't sound like very long, but just you wait. So what I'd like you to do is this. Play along. The worst you can do is fall asleep, right? The worst you can do is fall asleep. Okay. So the first thing you have to do is you have to uncross your legs. And you have to make contact with both feet on the floor. Because you have to ground yourself. And then I want you to close your eyes. And I want you to take your hands and place them palms down, fingers spread on the thighs, somewhere between the hip and the knees. And I want you to just breathe. And you know, for most of us, we breathe from the upper chest. And I bet you've all had days where you get home at night and you almost can't talk. And it's because we're so stressed we've been panting all day. And that's the breath of the anxious. But we're going to do something else today. We're going to put you in touch with a really deep breath. This is a practice of self-compassion. And so if it's hard, it's okay. What I'd like you to do is I'd like you to start breathing. And I want you to try to get your breath into your belly so that it's deeper and richer, so that your diaphragm actually works, but you're not going to force it, so that your lungs expand. And this is a body-mind practice. So what we're going to do is we're going to do a short body scan. And I want you to just observe any sensation without giving it a story. So start at the top of your head. Just pay attention to what you're feeling and try to relax the muscles of the scalp and the forehead. Soften your eyebrows. Just allow the eyelids to gently drape over the globes of the eyes, so nothing's tight. Drop the jaw. Soften the face. And take a few moments just noticing the quality and the quantity and the symmetry of the breath as it enters and exits your nostrils. What you're doing is you're taking in the environment and you're warming it with your passion and your compassion and your energy, and you're pushing it out. And now take the tip of the tongue and let it rest against the back of the upper teeth. Take your shoulders next, and your shoulder blades down, away from the jawline. And what that does is it lengthens the spine, it opens the heart space. And next, I'd like you to draw attention to your shoulders. What do you feel? Your upper arms, your elbows, your forearms, your wrists, your hands, and your fingers. Next, I'd like you to draw attention to your heart. And I want you to think about the goodness that you are, the goodness that radiates from you, and I also want you to think about the goodness that comes to you every day in very small and big ways. Let's next draw our attention to our lower lumbar area. And we can adjust the spine as we need to. And bring awareness next to your abdomen. What do you feel? Again, just notice the sensations without putting any thought behind it. Next, we bring awareness to our thighs. We separate the knees a bit. And we bring attention to our shins and our calves, our ankles, our feet, our toes. You want to spread your toes in your shoes so that your toes are active, so nothing is tight, nothing is clenched. What we're going to do is we're just going to breathe, trying to get the breath deeper, but that's not a goal. The goal is to count each inhalation and exhalation as a count 1, 2, 3, up till 10. When you get to 10, go back to 1. We're just going to play with this for 5 minutes. And let's begin. And welcome back. The longest 5 minutes of your life or not. So did you notice where your mind kind of went? Kind of all over? Did anybody get to 39? I've actually counted to 69 before stopping. Any thoughts? Interesting to play around with. I think it's interesting to use that exercise, and on VIN we sit for 25 minutes, several times a week online. How you deal with it, so if you think it's stupid, if you think it's boring, if you think you can't do it, if you're frustrated, that's a really good laboratory to kind of how you handle life. The one thing about mindfulness that's really helpful in clinical practice is that you can stay focused with who you are with in the room, and when you close the door, you can go on to the next. Because what I hear from veterinarians not infrequently is at the end of the day, they have like 20 clients that they're taking home to dinner with them. And basically, when you sit down for dinner, you want to choose your dinner companions really carefully. And you probably don't want to take every single client home with you. So, in closing, I'd like you to think about your place in animal welfare, be it in veterinary medicine, clinical practice, research, shelter work, as support staff. It's a vocational calling. There's something in the work that entices you so that you're called to the work as much as you call the work. It works both ways. And I think over time, you know, what you have, the class of 2018, is you're really excited. You still hear that call. Whoever it was, whatever happened, it's still really fresh. And I think those of us in clinical practice, sometimes we get deaf to that. And I think that also is what fuels burnout. We don't hear that original reason. So this is one way of keeping things fresh and focused. I'd like to think that we see our work as a privilege and that we can stand in the face of suffering, not be hooked by it, not push it away. That's not to say we tolerate animal abuse or that we tolerate the abuse of ourselves by either clients, employers, staff, other colleagues. But we need to look at ourselves with self-compassion, and we realize that at times, most times, we can only do what time and resources allow. And sometimes our clients are the limiting factors, but there will be times in all our lives when we're the limiting factor. We don't know something right away. I worked emergency for 2 years. There were some things that didn't come really fast to me. Animal presents acutely. And we have to have self-compassion about that and realize that we can only do the best that we can. None of us can be perfectionists. It's anathema to our calling. We can only try to help to the best of our ability. And can we find a path, perhaps through mindfulness, where we can recognize our wounding, be sensitive to the wounding of others, and find that place where we could heal? Did anyone have an opportunity to read the question by Chris Adrian before this afternoon? I'd like to close with that. So Chris Adrian is a very interesting person. He's a pediatric oncologist. He works at Columbia on the pediatric bone marrow transplant unit. He's a medical doctor. He's also a novelist. He has 3 novels. He has a master's in fine arts and creative writing. And he also has a master's in divinity from Harvard Medical School, Harvard Divinity School. So the joke that Chris tells about himself is he's a doctor, he's a theologian, and he's a writer. So the only 2 things that he really has to do next for next careers are to be a nail tech and do hair extensions. So I'd like you to read the question. If I had one thing that I would pass out to every single member of an incoming veterinary class, at every single CE conference that I've ever been to, I would throw it out of planes if I could. He wrote the question for the Journal of the American Medical Association, and I'll just give you kind of the brief synopsis. When he started his fellowship in pediatric oncology, his superiors told them, all the fellows, do not tell people what you do for a living because it's a downer. Tell them you're a pediatrician because everybody likes kids, but don't tell them you're a pediatric oncologist. So true story, Chris finds himself at a cocktail party and someone says, what do you do? And he said, I'm a pediatric oncologist. And they said, oh, pediatrics, well that's with kids, and oncology, that's cancer. That's like really bad. How do you do that? How do you work with kids with cancer? And of course, Chris is real early in his training, so all his patients are doing really good. And he says, oh, we make great strides. A lot of these kids do really well, knowing that back at the ranch, at the hospital, he has a child with astrocytoma that is not going to do well. So he wrote this beautiful 1.5-page essay on how do you answer the question. And you can read it for yourselves, and I hope you will. But he ends with a very, very important paragraph that I'd like to share with you. And he ends the piece by saying, anyone can, and most everyone does recognize the suffering of children with cancer and their families. But who among a world of witnesses gets to care for them? And then aren't we the lucky ones? We who are always generating awkwardness and bringing people down at cocktail parties, we pediatric oncologists, but we physicians, and we anybody whose profession puts us in the way of people's pain. And so that's our privilege. Out of all the world, we get to care for these creatures and the people who love them. Thank you.
I need to remind you guys that there is ice cream over there.